Early pregnancy units are places within the NHS that are based in each region of the UK, and they are where you go if you have a complication in pregnancy. So this would be things like a miscarriage or being very, very poorly, so very sick. And you get referred to the early pregnancy unit by your GP surgery or accident and emergency, also known as casualty. Another alternative route is if you've had a lot of previous early pregnancy complications, so multiple miscarriages, for example, you may be allowed to phone and tell them that you're coming in for treatment. When you're referred to the early pregnancy unit, you should be seen within 24 hours. And at that first appointment, they will do some tests to find out what's happening with your pregnancy. They may do a urine test, so you will need to give a urine sample at the hospital so they can do a pregnancy test with it. They might also take some blood to measure the level of pregnancy hormones in your blood. And also they will probably want to do a scan. So scans can take two forms. So the first is known as a transvaginal ultrasound scan. So that means it goes in through your vagina, and it's often a white, thin probe that they would put some lubricating jelly on, so it shouldn't feel painful when they do a scan, but it might feel a bit uncomfortable. And that would allow them to see into your womb, your uterus, and if the pregnancy isn't there, so they'll be searching to find the location, they can then look at your fallopian tubes as well with that type of scan. You're able to refuse to have a scan through your vagina. And if you don't want to have the scan that way, they can do an ultrasound scan of your tummy instead. In early pregnancy, so kind of around 6 weeks, they might not be able to see everything they need by doing a scan of your tummy. So if they aren't able to see that, they might then ask again if they could do the scan through your vagina, but you're always allowed to say no if it's something that you really don't want to happen.